everyone. My name is Tonica Robinson, and I work at Riverside University Health System Behavioral Health. I have been here. I started here in 2017, then I went to a different agency, and now I'm back. So I am the manager of innovation and cultural competency. And so that's two different units that operate under the umbrella of behavioral health. And so I'll break them both down for you. First off, innovation. Innovation is funding that we get from the state on an annual basis that allows us to do something that's like medical research, but in the mental health realm. So we're able to put together projects and test them out. We have 3 to 5 years to test out these projects, these plans, see if they work. And if they do work, then we find ways to absorb them or a portion of them in our service delivery system. If they do not work, it's not a failure. It's looked upon as learning. And so we learn what does and what doesn't work for the community. We report that back to the state and they could share it with other counties so that counties know what does and doesn't work for different communities. So that's the innovations work. That's a very short, brief sample of what innovations is. But remember, it's time limited. It's 3 to 5 years. It involves heavy stakeholder process. So we're out in the community a lot, getting feedback, finding out from our consultants, our contractors, just the people with lived experience, our clients, finding out what we need and what they think would address those needs. And so that's pretty much what innovation is. When it comes to cultural competency, that arm of my job is making sure that our services are culturally competent. And so we address a lot of disparities that are happening in the community when it comes to behavioral health. And so we have an umbrella of a lot of different pocketed populations that we serve. And so that's like, we look at veterans as we just started looking at veterans as an underserved population, the deaf and hard of hearing community, the Latino, Latina, Latinx community, the African American Black community, the AAPI community, the All Abilities community. It's the Native American community. There's just so many different communities that we do a disparities report with our research team. So every year our research team produces a report that tells us where our disparities lie. And we work really closely with those communities to try to address those disparities, put programs in place, and we actually hire on people to help us do that work. And we're actually in the process of hiring on some people this week. So that's the cultural competency side of it. I am not a therapist. I have a long history of working in public service, and starting from the very beginning, my schools, I went to UNLV for my bachelor's degrees. I went to American Public University for my master's in public policy with the emphasis in public health. I got my law degree from USC and with the focus in healthcare compliance. And so that's the track that I took. I'm currently a doctoral student for my doctorate in behavioral health. So that's pretty much what my role is. That's what our department does. It's a lot of community outreach, a lot of addressing disparities, a lot of sitting down and talking to people and hearing what they have to say. I would say to be in a role like this and to be a member of my team, you must have thick skin, because we are so involved with the community that it's great when we hear the things that we're doing great, but when they're angry and they're looking at you as that county representative. And so you have to be able to take what they're saying and speak to them. And then even if they're saying something that you don't like, you have to take it, speak to them, and then still possibly schedule a meeting with them to see how we can work to address the concerns that they have. And so that's externally. And then even internally, we do a lot of work with making sure that all of our services are culturally compliant. So we work with the compliance team a lot. We also work with our workforce education and training to make sure that our staff is culturally informed. And so we put on trainings and things of that nature. That's pretty much it. Again, I am not a therapist. I am the behavioral health management side as well. However, to get in my position, it requires a master's degree, and it can be in business and public health or public administration, and this is the one that's really, it's generally someone who has that MSW background, so a social work or a behavioral health field. So those are the requirements for this position.